boobies, tits, tatas, melons, jugs. Am I missing some? There's so many names we call our boobs. There's so many ways we refer to our boobs. But here's the fun bit. We don't actually know enough about our boobs. Hi, my name is Dr. Tanya. I'm also known as Dr. Cuterus, and today I'm here to talk all about breast health, especially related to cancer. Today we're going to be talking about the ever so serious topic about breast cancer and learn more and find out how you can protect yourself, how you can examine yourself, and what breast cancer really is. So let's first discuss what cancer is. If you get an idea of what cancer is, then we can simply think of it like cancer in the breast, and that makes it easy. So normally our cells know when to stop dividing. You know, our cells have these inbuilt mechanism that they're like, yeah, cool, you're big enough now, we'll stop growing. Essentially, our cells have this inbuilt mechanism that stops them from becoming a giant. The problem with cancer is that these inbuilt mechanisms fail, and the cells keep growing and growing and growing and growing. When they keep growing and growing and growing, this becomes a tumor. And this is exactly what happens in any cancer. Breast cancer is the same. You get tissues inside the breast, cells inside the breast that basically just never stop growing. And this forms a tumor, and a tumor usually is found in the shape of a lump, which you can find when you're examining yourself and then you go to the doctor. This is what cancer is. Now the breast, the cancer can show up in many parts. Cancer can be on the surface of the breast, it can be on the areola, or it could be on the nipple. The breast in itself is, that large globular piece. You've got that little protruding part called the nipple, and the pigmented area around the nipple is called the areola. When examining for breast cancer related changes, you have to examine all three of these parts. But how do you examine? Let's understand the basic examination. There are a couple of things that I always recommend that are very, very helpful in remembering how to do your examinations. There are a couple of poses that we're going to talk about. What are the things you should look out for and how to look out for them. So, when doing a breast examination, always remember your A, B and C's. What does this mean? A means your armpit. So when doing a breast examination, always examine inside your armpit. Aside from this, of course, you examine your breast itself and examine the area above your collarbone. Sometimes if there is a breast cancer lump present, it can reflect in the armpit or the collarbone aside from the breast as well. It's a great place to check. It's a great way of knowing, especially if you have larger breasts, because it can be hard to find a lump in case you do have larger breasts sometimes. Now that you know your A's, B's and C's, the next question is, when exactly does this breast exam have to happen? For the timing of the breast exam, what you need to remember is that it has to be done on the same day every month. Another great sort of reminder or internal calendar is if you do it 1 week after your period. Your hormone levels are low, so there's nothing that's influencing the texture of your breasts. Sometimes around your periods, your breast can be very heavy or dense or tender, and this can be a very painful time to examine the breasts, which is why a simple internal reminder, 1 week after your periods, best time for examining your breasts. Now that we know when to do it, now that we know what to look for, comes the next big question. How exactly do you examine your breasts? So let's break this into two parts. The first part is the looking, and the second part is the feeling. Every time you do your breast exam, every month, you are a superhero, and that's how we will remember our poses. Remember your breast exam poses as superhero poses, and you will remember how to do a breast exam. The poses are 3. For the first 2 poses, you will be standing up, and for the third pose, you will be lying down. For the first 2 poses, the first is your standard superhero pose, like Superman poses, except you're Superwoman or whatever gender pronoun you prefer. Take your hands, put them on your waist, and basically just go in the mirror, check your hair out a little bit, and stand tall. Stand tall like this, shoulders back, chest out. And just simply take a look at your breasts. You can find out if there's anything that looks obviously abnormal. What this means is that if you see any changes in the shape, in the color, in the texture of your skin, if you see any red blotches, any blue dilated veins, any change in how the skin generally looks, particularly if it starts looking like an orange peel. Now that's a very specific description, but what I'm referring to is something that in medicine we call dimpling of the skin. If there is a lot of fluid collection in your breasts, you can see little dimples or little dots on your breast. That kind of looks like an orange peel. This can be a sign of breast cancer, so always make sure to look at the color, the texture, and the general look of your breasts. When examining, remember to look at the entire surface of the breast. But one thing tends to get missed here, especially if you have larger breasts. The skin under the fold of the breast can be missed sometimes, and that brings us to our second pose. The second pose is superhero takes flight. You take both your hands and you lift them up in the air, and then you look in the mirror. What it does is that it lifts the skin of your breast, so if there's anything hiding under there, you can also see it. So we've covered the two standing poses that involve the looking. Once you've done the looking, now you want to do the touching. For the touching, what you do is you lie down, and now your superhero is just having a chill day at the beach. Take your hand, this should be your free hand, and lie on the bed and comfortably put this hand behind your head. This will kind of pop out your breast tissue a little bit, and once you've done that, using your free hand, examine the breast. Do the same on the other side and repeat with your other hand. When you're doing this, you can follow a specific pattern. Most people prefer going in circles, but you can also follow a Z-shaped pattern. If you're going in circles, you can start in the middle and move outwards, or you can start on the outwards and move in the center. Just keep going in a circle and using 3 fingers, gently squeeze, examine your breast. Feel for any changes, any lumps, any weird texture, anything that's not normal, that doesn't feel like regular soft breast tissue. Remember to do it with 3 fingers, not with 2 fingers, because if there is a lump and you try to press it, it can slip between your fingers. Now that you've done your touching, you have completed your breast exam. Literally, it's that simple. Just look and feel. And you make sure your breasts are free when you're doing this. So you should not be wearing a bra. And ideally, I recommend doing this after the shower, because then you're naked anyway and your skin is soft and you're relaxed, so you can easily examine your breasts. Why I keep insisting on this examination is because 8 out of 10 women who are diagnosed with breast cancer, they find the lump themselves. This is a huge number, and this is just an indication of how important it is to understand what your normal breast tissue feels like. So if there is something abnormal, you will know immediately. Now, hypothetically, let's say you found a lump. You found some tiny lump over here that feels maybe like a walnut-sized lump, and you're very concerned that, okay, what do I do? This lump also hurts, and when you squeeze it, it tends to run away. You're very, very concerned, you're freaked out, you go to the doctor. And by the way, this is what you should do if you do find a lump. You go to your doctor, because the doctor is the only person who can tell you if this lump is normal or abnormal. So, you're at the doctor's office and the doctor will examine this lump. Now mostly, and this is not the rule, but mostly, painful lumps tend to be non-cancerous. So if you have a lump that doesn't hurt, this is usually an alarm sign. But this is not the rule, there are exceptions to this. So always, always, always get examined. Another common characteristic of a non-cancerous lump is that if you squeeze this lump between 2 fingers, it will tend to move. In medicine, we call this a breast mouse, because every time you squeeze it, it runs like a little mouse. This is a normal condition. A lot of people do have denser and lumpier breasts. This is particularly more common in younger people and tends to go away after menopause. Once again, your doctor will be able to tell you if this lump is normal or not. But you should definitely urgently run to the doctor if you find a lump that is fixed or painless. The size of the lump doesn't matter. If you find a lump, show it to your doctor. Your underarms and above your clavicle or your collarbone is also important. Do not underestimate the importance of doing breast exams.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.